you, Jen, because I wasn't recording this, and now I am. So this is very important. In fact, I'm gonna, for this meeting in particular, because it's a roundtable, I'm gonna not only record it, but I'm gonna have a transcript of it, so that hopefully we can share a bunch of the ideas that we're discussing today. Okay, and let's see. Okay, and Juan says, sorry, I was playing with the hand raising. I wanted to ask if there's a way we can get a copy of the chat history. Yes, that is one thing that we always do, Juan and everybody, for the webinars that I organize, is I record that chat history so you can go back and use it. It's sort of like a business card exchange. Okay, yeah, and okay, I got it. Okay, and I will cut and paste that so that we have 100% of the chat there. Okay, so I'm really psyched to jump into a dialogue, but before we do that, I have a couple of hold on here. I have a couple of things that I want to share with you to sort of kick off the context of the meeting. So first, I want to just share what I've got on the screen is sort of how I kind of organize the vast, confusing offerings of senior living services into an organized group of buckets, okay? So the first bucket is housing. Anything related to housing older adults, and doesn't mean that it has to be exclusive to older adults. It could be, you know, somebody moving to a condominium to embrace a more carefree lifestyle. The second bucket is the aging in place bucket, and that there are countless numbers of organizations well beyond home care providers that help people age in place, ranging from transportation, grocery delivery, universal design, remodeling. Adult daycare could be viewed as a support tool for people aging in place. And then the third bucket are any other resource that is out there. Oftentimes, the ones that I throw into this bucket that people are aware of are aging life care managers, elder law attorneys, daily money managers, and area agencies on aging and groups like that. So these are in general, the buckets that I put how I categorize aging services. And I just wanted to share this with you just to kind of assist us in our dialogue. The next slide that I'm sharing is sort of when you know, I've been doing this for 30 years and I've had hundreds of conversations with organizations on their marketing. And in general, when I'm trying to help people break down their strategy and assist them with their outreach and the various, you know, different tools that they have and creative strategies, I again kind of break things down into three buckets when I'm talking to senior care providers. The first is, who are your clients? Understanding who your clients are, what they're about, and digging as deep as possible into kind of understanding who these people you are serving are. Because one of the easiest ways to frame a marketing strategy is, it's sort of like, you want to grow your business, you got 5 customers right now, we just need to find 5 more and you've doubled your customer base. But we can only do that if we really understand who your customers are, okay? The second bucket is who your referral sources are. And this is very important in the senior living space because most of our businesses can almost rely entirely on referrals. Is that you know, that elder law attorney has a client who needs, you know, more support than the estate planning that he's offering, and he's able to call you up and say, hey, will you talk to Joan about this? But again, just like understanding who our clients are, we need to understand who our proven referral sources are, and nurture those relationships and grow more of those relationships. And the last bucket that I refer to is who we refer to. This is the opposite of our referral sources. So many of us are working with older adults and their families, and we have a limited lane of services that we can provide to these individuals, but their needs are much greater. And so we are all out there referring to other organizations, and having a handle on who you get referrals from and who you give referrals to can really help create a result producing marketing strategy. Okay, that's me on my soapbox. I am going to stop sharing my screen now, and I really want to dive in and start hearing from you all about what some of your marketing challenges are, what some of your marketing concerns are. What if we do an ongoing series like this, you know, until we get back to what we might call normal? What are the topics? What are the things that you want guidance on? And just to kind of give you a glimpse at what's on tap next week, is next week I have already scheduled a session at this time that is going to focus 100% on digital marketing, what the options are, how you can investigate those. Because as you know, I mean, the good news is that we're all utilizing digital platforms now. And so so to connect with our customers, having an understanding of all the digital marketing techniques that are out there, I think can be helpful to our group. Could you get to, oh, here, I'm gonna just stop sharing the results. Oh, I apologize, guys. If Judy mentioned that the survey was in the middle of the screen. I think there's a way that you can take that down, but I've taken it down. So thank you. Okay, so the two ways that you can participate, guys, is raise your hand to talk, or use the Q&A. And and let's kind of get this roundtable discussion going. And guys, I'm going to tell you, I mean, we got 140 some people here. So getting on and asking a question, it's a great marketing resource in front of a bunch of influential professionals. So our first participant here is Cordell. Cordell.
Thank you, Steve. My name is Cordell Martin. For those of you that don't know me, I work for Tribute at Melford, what would be considered the sales and marketing capacity. I have found these meetings to be tremendous, because how many times do you attend an event and you have a good crowd, but you can't get to everyone and you don't know what everyone does? And so to me, this is a tremendous tool. I appreciate, Steve, what you've done as far as, I mean, last week we were learning about robots and technology that was coming out that I would never normally be able to access because of trying to find marketing opportunities. But also I find that, and I'll jump into the other part of this conversation, which is the tools for marketing. I think all of us have to be comfortable with the idea of working with people that normally we might consider to be competitors. On this call, I've got one of my sister communities on there, Beth Sanchez. She does what I do for our corporate company, Thrive. She does that in the Germantown area. But also I see Mark Ash that's on there. He's got a home care business specifically for non-medical. I see a good friend, Dawn Lewis, who's with Parkinson. I mention that because you think of senior living, you think of home care, and maybe they're competitors, but I've learned a lot depending on what that home care group offers. And I think, at some point we're going to have customers that may choose to stay at home. And it's nice to be able, if it's non-medical, I can refer those to my home care specialist, Mark, who I know does that for non-medical. If I've got someone that has a concern for Parkinson's, a caregiver, I know I can refer them to Dawn Lewis. And if I have someone that needs assisted living, I know I can refer them to our sister community at Black Hills. So to me, I think what Steve has created is an atmosphere and an environment where we can meet other people who we may at one point view as competitors, but that at the same time offer value. And so I would rather take advantage of that in a positive way. And when I have a resource that I'm not able to help, we use a term called do more good. I have no problem referring that source to folks that can help them, so that at the end of the day, even if I'm not someone that they can do business with, they're getting a value out of people that I know are going to do a good job for them. So I'll step off of my soapbox and shut up.
Man, awesome comments, Cordell. And I'm just gonna, oh, come on here. I'm going to get to Michelle next, but I want to just throw a couple of points to Cordell. Spoke very well on this, and what's been interesting, I mean, there's some really good things about what's happening with COVID-19 in terms of bringing us together as a community. And you're right on when it comes to sort of like, how are we going to market our field, from aging in place to resources to housing. If we come together and we collaborate more, it's going to help everyone. And the interesting thing that Cordell brings up is, from a competitive point of view, is that over the years, whenever let's say I'm meeting with a housing provider or a home care provider, and we're evaluating where their referrals come from, they'll always discount, like I'll look at a list of referrals that they'll provide me, and I'll be like, what about this over here? And it's like, oh, well, those are my competitors. And it's always amazing to me and to the clients at how many referrals home care agencies get from other home care agencies, how many referrals a housing provider gets from the other housing provider down the street. If that housing provider doesn't have a 2-bedroom apartment, it's sort of like, hey, look, we don't have one, but Cordell might. So thanks for bringing that up, Cordell. Great points. Next on the line is Michelle Fritz. Michelle?
Hey, Steve, thank you for what you're doing. And Cordell, I agree with all of your points. They were fantastic. I have a question for the group. So I'm a board certified in geriatrics clinical pharmacist, and I work with people around the ages of retirement into their 70s, 80s, and beyond. And I'm concerned that right now during the pandemic, a lot of people are not doing the same amount of self-care they would normally do, and that chronic conditions are not receiving the attention they need. And I guess I'm talking to the people that are more home-based, because I know in assisted and skilled living, you guys are doing a wonderful job. But for those that are on their own, I anticipate that we're going to come out the other end of this with a lot of medical conditions not well controlled, and medications needing a lot of adjustment. And just wonder if y'all are seeing the same or anticipating the same.
Great, Michelle, great comment. And so on this one, guys, this is a great thing Michelle's question, where we address that is in the chat area. And again, just a reminder to everybody, make sure that your drop down says all panelists and attendees when you're responding to that. But great feedback, Michelle, and I agree. You know, the older adults that are isolated at home, I mean, we don't even know the beginning of what the future issues are going to be as we go through this. Okay, let's see. Okay, so I got okay, I'm going to get to Latasha Williams next, but before I do, let me go through some of the questions that have been posted here. Todd says, do you have any meter on how to balance direct mail and social media communications across multi-generational demographics? Do older adults still like going to the mailbox to get advertising? You know, Todd, on that topic, I could give you a, you know, my just off the cuff response, which would say that my gut level tells me that probably direct mail campaigns now more than ever are way more effective, because if we all look at being isolated at home and the fact that, you know, you're eating your sandwich or your cereal, like I've been reading all the marketing literature that's coming in my mailbox, whereas I used to just throw it away. So I think there might be some benefits to snail mail marketing, but this is just a gut level impression. Next week on Tuesday, I've got an expert who's joined our team who's going to be able to dive a little bit deeper into how we can target demographically and psychographically using digital media. So thank you, Todd, for those comments. And I will try to provide the group with more details on that. Stephanie Lawler says, what are people finding works to stay in touch with referral sources? And so, guys, this is where use the chat to respond to Stephanie's question there. It's a good one, and it's one that we should not be afraid to share with our colleagues. And what you can also see is that there, and this is what I hope happens by bringing this group together, is that your friendly referral sources, you may team up and create some email campaigns or some outreach campaigns together where you're addressing maybe aging in place issues and housing issues together in one email and sharing referral lists. Melinda Merck says, as you know, McClandish Lilliard is having a webinar next week on simple steps to estate planning. We are looking at GoToWebinar and Zoom webinar. It appears you've been using a Zoom webinar. What are your thoughts? This is a really good one, guys, because webinars like this are amazing ways to communicate with your referral sources and your clients. Now, the only reason, well, one of the main reasons that I am sticking with Zoom is I feel like there's a familiarity. It's almost like we're calling, even if you're on a GoToWebinar, it's like Kleenex. It's like, oh, I'm Zooming, or I'm jumping on a Zoom meeting. And as you know, it's hard to get used to the navigation buttons and things of that nature. Just given the scale of Zoom and the fact that they've achieved such market dominance, I'm playing around with Zoom. However, you know, like this chat where I have to constantly remind you to choose all attendees, that's something that's kind of frustrating. And I know there's another platform out there called Crowdsource that's a little bit more user-friendly. But my recommendation is play around with the different platforms. And to everybody on the group, if you want to give me a call, my number's right there in chat, and I can sort of give you some guidance on what I've learned since I've started using these platforms. Okay, I'll get to those other written questions, but let me go down the list here. And it looks like, oh, okay, I said Latasha's next, so I'm gonna put her on. Latasha?
Hello, everyone. Hello, hello, hello. Mr. Steve, I want to say first, thank you. Thank you for these webinars. Thank you for these sessions. I have learned so much. I am, first, let me put it out there, with Senior Helpers of the Alexandria Arlington area. I'm the Director of Client Services / Sales and Marketing. We are a home care business that started about 3 years ago, and I am very, very new. Like 2 weeks into my position, COVID-19 hit. So
Great time to start a job, huh?
exactly. So I am very new to this. I just wanted to kind of piggyback on what Mr. Cordell said about working together, seeing that as being or building like an ecosystem between the healthcare administrators, healthcare workers, anybody in healthcare, which is right now an a very good opportunity to do that. Everybody's at home, nobody can do face-to-face, you can't get out, you can't do anything. So building that ecosystem of, okay, we can go to this person, this is who does this. Everybody does things a little differently. So, working together, as Mr. Cordell said, right now is an awesome, awesome thing. And, if anybody's in the Alexandria, Arlington area, let's Zoom.
Yeah. No, I love it. Now, let me here, I'm going to mute you, Latasha, and I want to, trust me, guys, I don't ever want to appear to be too self-promotional, but and shoot, I'm not making any money off of this, so let me kind of share my screen here, because I'm going to show you how I hope we'll have a tool that can whoops, wait, hold on. Okay, I'm going to share a screen, and I'm sharing this screen. Okay. So this is the Pro Aging Network. Many of you may already be on this, but if you're not, I just want to show how this can work specifically for this group, the marketing group. So what you see here is this is our general discussion on the Pro Aging Network, and you can click on members, and you can see there's hundreds of providers, many of you guys who are on here, and you can click on their picture and you can have a conversation internally here, okay? But then if you go down to groups, you'll see the Marketing Mastermind group, and you can join that group. And this is where I'm going to start posting a lot of the suggestions and dialogue and things of that nature. And one of the things that I would say is that if we jump in the Marketing Masterminds group and we're talking about marketing and we're talking about cross referrals and we're talking about all this crazy stuff, that's okay. We're not going to offend the social workers and the government workers, the people that aren't necessarily, the people that are serving older adults but might not be marketers. So take advantage of that, and I hope that this will be an area that can help us all. Okay, our next person I've got is Noel. Noel?
Hi, Steve. Thank you very much. Appreciate it. And I've always found these webinars and your programs to be very enlightening. Steve, I have a question for you.
Oh, first off, Noel, who are you with and what is your profession?
I'm sorry. I am with Ellen Platt's The Option Group out of Hunt Valley, Maryland. And I started as their community outreach liaison about 5 weeks before COVID-19 hit. So
yeah, and that's in the aging life care Ellen is an aging life care manager. So this is, I'm really interested in your thoughts and perspective.
Thank you. Appreciate that. So here's my question. As we're trying to figure out how to stay in touch with our referral sources, and also to make sure we know who we want to refer to meet those folks as well, as you had mentioned earlier, we sent out an email blast by MailChimp. So here's my question. What is an acceptable percentage of people who open up an email like that? And is it worth our time and effort to do that?
Okay.
Thank you.
Really good question. And one that I'm gonna dive that next week when we do the digital marketing. I'll try to pull up some statistics on email marketing and what are the metrics that we can measure with. One thing that I know that MailChimp and Constant Contact and some of the other providers do is in the admin area, if you select an industry, and for most of us, it's going to be healthcare, okay? Oftentimes what they will provide you with is a metrics based on your industry metrics, okay? So again, let's say that you select healthcare and the industry metrics is 10% open rate or something like that. And you're at, 8%. So it's sort of like, okay, what can I do? What can I do to better increase my open rate? I'm blown away at the resources that MailChimp and Constant Contact provide. There's sometimes a lot of creative things that you can do. There's A/B testing to see what kind of subject line opens more, opens less. I think one of the things that I'm really concerned about when it comes to email marketing is the frequency and the volume that I'm sending out now compared to what we were sending out pre-COVID-19. I feel like I'm sending out an email like sometimes 3 or 4 times a week. And, oftentimes when you're sending out more emails, it increases your unsubscribe rate. So that's something that we all have to be concerned about, but definitely join in on the digital marketing next week, and I'll dive deeper into that as much as I can. And what I really see us doing here over the next, several months is, like today, this is a roundtable discussion where we're just talking about everything, everybody's concerns, okay? Everybody's challenges. But then what I could see us doing is diving in and doing a whole session focused totally on crafting our emails and sharing, hey, what works for me and what doesn't. It's not necessarily, this type of collaboration does not necessarily hurt us, because oftentimes our email lists are going to different people, and maybe there's a little bit of crossover, but especially when we're talking about our prospect list, oftentimes those are different, okay? And then I also want to talk to you next week about how you can rent lists and purchase lists of, and dive into that to enhance the email that you're sending out. Okay, let me get back to some of these questions. Again, if anybody wants to raise their hand to jump on, just raise your hand under the participants panel there. But Angela White says, how do we continue to operate an adult daycare center when we are hands-on with Alzheimer's and dementia clients and we have to continue to social distance ourselves? Angela, thank you for sort of bringing up the question that is the elephant in the room that we are all dealing with. Or I shouldn't say we're all dealing with, but I think at least half of the audience, based on the survey that I posted when you guys came in, we provide a service that we cannot accept people to come in, adult daycare. Many of the senior housing providers are not bringing in new folks, and I don't necessarily have the answer to your question on specifically to adult daycare, but what we all have hope for is that things are going to change. Things are going to open up sometime in the horizon. I noticed I caught myself. I didn't say the near horizon as much as I want to say that, hey, this July, you can come back and start accepting, your adult daycare is going to be buzzing just like it used to be, except for people are going to be standing 6 feet apart. We don't know when that time is going to come, but we do know that it's going to be different. And so I think the key thing is maintaining contact with, if we're in that situation, like an adult daycare center, maintaining contact with your connections, your current client base, your previous client base, your current and future referral sources and partners, coming up with some ongoing dialogue with those folks, letting them know that you are out there as a resource, even though people can't come into your building now. We want to support you. And I mean, one of the things I could see happening, and this is me just brainstorming, with an adult daycare center, it's like, again, let's say that you have 20 or 30 participants. Maybe it's getting the PPD on and getting the existing staff out there to meet one-on-one with some families and clients in their home if they're willing to accept you as a visitor, and sort of providing that adult daycare, albeit temporary, and it might just be once a week or once a month in their home. I'm just brainstorming here and trying to think outside the box, but thank you for bringing that up. Stephanie Lawrence says, are communities accepting admissions right now into assisted living and independent living? If so, how are you doing this safely? Okay, this again, guys, awesome question that Stephanie is bringing up. Throw your responses into chat. I'm super excited to see the feedback, or raise your hand and I can allow you to talk. And with that, I'm going to bring Mary Ellen Connect online. Mary Ellen, your hand was raised.
Yeah, I'm unmuted. Did I raise my hand again?
Yep, you're good. Oh, you did that by accident?
I was looking to see what the questions were that was out there.
Okay. Mary Ellen, you got the microphone, so tell us who you are and
Okay.
tell us what's going on with you in the marketing world.
Okay, I'm Mary Ellen Kinnett. I'm with the medical team. We're but we are full service as far as private duty, home health, hospice, county services, etc. So I believe that, right now it is our job it is my job, I think, to reach out in a caring fashion to people who are stressed in their assisted livings, where they're dealing with a lot of people who are either sick or they've had a lot of deaths. So we're trying to reach out in a caring sort of way as opposed to a selling kind of way. We do have things that we think would be supportive, but we're not always getting them to bite on those. I really think we have some things that would be helpful, like senior chats and support for the staff. But I do think that our assisted living people are on the front lines, maybe in a different kind of intensity than ICUs, but the difference is they know those people who have died. They've been with them and stuff. So I'm just trying to offer support there.
Thanks.
And I don't have a great idea. So
That's okay. No. Thanks.
Okay.
Let's see. Okay. I am going to read, I'm glad we're getting through these questions here. Rhonda Thomas says, this has really impacted people that have had surgery scheduled for chronic conditions. My dad has been experiencing some pain and he's concerned about having to go to the hospital. Rhonda, you know, my heart breaks for you, your family, and all the other families like yours. And we got close to 150 people on this call that might have solutions. So guys, go into chat, make sure that you select all attendees. If you have some solutions for Rhonda, make sure you throw them up there. Okay, let's see. Gary Hughes is saying, curious about how many, if any, are co-marketing to reduce marketing costs and increasing effectiveness. Gary, that's sort of my dream in bringing the community together in this time of crisis where we're all getting slammed with budget challenges because we had to spend, you know, thousands of dollars on PPDs and things of that nature, and our revenue is going down. It really does make sense for similar partners to do some co-marketing and brainstorm, and for future events, or even if you've done this in chat, throw it out there, because this can give other folks a good idea. Terry Gross says, it depends on whether they have okay, this is in response to buildings accepting people. Terry Gross works for Arden Courts. Depends on whether they have active COVID in their building or not. The health department will not allow you to accept any admissions once you have an active COVID case in your building. Individuals, companies may have stricter policies than that. Man, thanks Terry for sharing that. And let me go to Barbara Pullman. Barbara?
It's Putnam, but thanks, Steve.
Oh, sorry, I can only see the first name, and okay.
That's okay. I was actually raising my hand to respond to the question about assisted livings or memory cares accepting new residents. So I'm the managing director for Fox Trail Senior Living. So we have communities in both New Jersey and in Virginia. In New Jersey, per state regulations, because we have active COVID in the community, unless we can break them out into 3 separate cohorts and staff them independently of each other, we are not allowed to take or do readmission of residents who are COVID positive. In Virginia, we've been fortunate enough not to have COVID identified in our communities. However, we have very specific protocols that we put in place in order to accept new admissions. One of the most important was that we limited respite stays to 60 days. Anyone coming in has to show 2 negative COVID tests within a 24-hour period before they can come to the community. They're also on 14-day complete droplet isolation from the point that they come in. All of our residents are in quarantine independently anyway. Everything is done within their room. So we are able to accept new residents based off of that, but I would assume that at least in the state of Virginia, there would be very specific protocols in regards to accepting anyone who was COVID positive. We also have isolation units set up in our communities. We've been hesitant to accept any new resident who's COVID positive because we have no COVID in our community, because if we were to develop it at that point, we feel like families would automatically assume that it came because of that isolation unit. But we do have the capacity. We just haven't, because the state of Virginia has not reached that point where the hospitals are overflowing and have to have some place to go. And hopefully we'll never get there. We have not had to use it. So that was just my take.
Man, Barbara, thanks so much for sharing that insight, because it's a question that I receive daily from providers and consumers on, you know, how are different communities, you know, accepting people. And that was a very detailed explanation. It was very helpful. I also want to sort of spotlight your organization as one that has done some really creative, transparent outreach. So Fox Trail, they have a weekly webinar that's open to providers and consumers, and they have their team on there. They have competitors. They talk. They are sort of what we've been talking about. They're open to collaborating with others, even if they might technically be viewed as a competitor. And I am going to, let me see if I can do this real quick, because I want to explain to folks another resource that we've got that can help you get the word out about your webinars, about your outreach events, and it doesn't cost you anything. So so we have our at positiveagingsourcebook.com, we have this is our event calendar. So if you go under events there, you will see upcoming events. And this is where we try to post any online meeting or event for providers and consumers that we come across. And you guys can post directly on here, or you can email them to me. So for example, I'm trying to find, I know we've got the Fox Trail event is on here. I need to, because I posted it up there, but if not, I'm going to repost it so that if you guys wanted to tune in and join in with Fox Trail on the their meetings, that you can. Okay, let's see. Back to raising the hands here. Let's see. I've got Dana Rizzo.
Hello, can you hear me okay?
Oh yeah, Dana.
Yeah, okay, hi, I'm Dana Rizzo and I'm a registered nurse and the area manager for business development for Walton Wood Ashburn. And we are a senior living community that offers independent living, assisted living, and a secure memory care community. We have stopped accepting new residents way back March 6th. And we had been implementing all the CDC guidelines. Unfortunately, even with that, we ended up getting COVID, 2 cases of it into the memory care community. But because of the excellent PPEs and all of the isolation that we've had, one person has come off of isolation and is doing fabulous. The second person we tested her a second time after she was actually on isolation for 17 days. We've retested her and she came back positive again. But it looks as though the Virginia Department of Health, Loudoun County, stated that they weren't surprised with that second positive for the simple fact that her body has made up antibodies and that they expected it to be a false positive test. But the Loudoun County is requiring that everyone that had tested positive for COVID not only have a 14-day isolation period, but then extend them another 14 days of quarantine, just to make sure that the 28 days that the virus is not shedding. But as the previous person mentioned, I think her name was Barbara, there is no cross exposure. We are keeping the independent living people separate with their own team of care managers, assisted living with their own team of care managers, and memory care the same. So there's no cross working in the different communities. And they've been dining in their apartments with disposable products. But we're now opening up as CDC starts lifting some of their restrictions, and they're allowed now to wear PPE and to walk with social distancing in the hallways. They can go to activities with only 4 people in a group. So slowly we're regaining a little bit more normalcy, and they're allowed to go outside because we have 14 acres of beautiful areas, gardens. So they're walking outside, but it's been real tough. And I really, and Mary Ellen addressed this, that there's been a lot of stress for our wonderful teams, these frontline workers that day in and day out, they give their heart, they come to work with professionalism and compassion. So the things we're doing for them are just special lunches, special dinners. We have entertainment for them, virtual concerts, and we even have a beautiful courtyard, and all of the residents balconies overlook the courtyard, and we had an outdoor concert that was a big hit. So all of those things are keeping people engaged, but I'm amazed at the creativity and the imagination of our activity living coordinators too. They've done so much, but this is a very helpful format, Steve. Thank you.
Yeah, I mean, thank you, Dana. And I think, you know, for a lot of us, this is like a support group. I mean, and we're getting close to wrapping up. So if you've got, definitely raise your hand if you want to say something. But I want to jump on a couple of things that Dana and Mary Ellen said that I related to marketing. Number one, imagine marketing our companies and organizations was challenging before COVID-19 when we had no restrictions. It was not an easy job. I mean, I know because I've been helping you guys for 30 years doing it. When I hear Dana talk about all of the, and the Fox Trails team talk about all of the restrictions that are mandated, you know, you can't have this type of person come in. If they do come in, they have to do X, Y, and Z. And now to sort of like say, well, how am I going to get new customers? It's monumental, the challenges that we're facing. But this is where us coming together as a group can be helpful in sharing resources, in sharing ideas, in coming up with new ways to approach these challenging issues. Mary Ellen prompted me to bring up something that she brought up in terms of, you know, senior housing partners, that those of us who are not senior housing providers, those of us who are in the aging in place and the resources bucket, these workers they're putting their own health at risk. They're working unbelievable hours, and and you can see on social media, which I think is fantastic, where a lot of partners are supporting them with pizzas and, you know, nice gift baskets and nice words of gestures, or, you know, greeting them with a parade, you know, when the shift is over, things of that nature. From a marketing perspective, I don't like to frame this stuff as marketing. This is supporting our partners. However, let's think about it. It's sort of like support those people that have supported you and that need help. And when we get through this, it's going to make for much more meaningful relationships, which can result in better business for all of us. Let's see, Barbara, you got a comment?
I actually just wanted to pose a question that maybe everyone can think about before the next podcast in regards to marketing. Been doing a lot of independent research on how to begin the long-term planning for senior care. And I'm sorry, my 4-year-old is behind me, so I apologize about the background noise. My focus right now has been on digital and virtual marketing. So I'm interested to see what other people would think that looks like. I mean, we're doing flip book tours and we do maybe FaceTime tours, but I'm thinking something future-wise of more high-end. I'm sure you all seen the real estate virtual reality tours you can do of a home. I'm thinking that, you know, senior housing might have to move towards spending some serious marketing dollars on that virtual reality tours of our communities. And I'd like to know what other people think and how it could be implemented.
Absolutely. And guys, use chat to share your ideas there. And then I'm gonna take some of these points and I'm gonna put them on the Marketing Masterminds group, and we can have discussions around this where, again, this is a closed group of marketers. So let's have some dialogue on, hey, this is what I'm doing, what have you. And next week, again, we're going to do the digital marketing focus. We're going to try to cover a lot of different things. So I don't know if we'll be able to dive very deep, but I've made a note, you know, to make sure that I include some details on email marketing and digital marketing. Now, one interesting thing that you know, and I kind of learned this from doing video production, is that sometimes it's sort of like we want to jump in with this sort of like high end, insane, video production. It's like I'm walking through a virtual reality tour of a community, okay? And there's this pressure where it's like, oh, I gotta go in that direction. Yesterday we did a webinar. Some of you may have been on it, for the DCSRG group. And that meeting was supposed to be at Ingleside at Rock Creek. And instead of doing the, instead of being there, we had one of the staff members just walking around the community with her phone on the Zoom conference call. And it was so authentic. It was so, it gave me a feeling of that community that didn't feel like it was sort of antiseptic and so well produced that it's like, that place doesn't look like that. So I'm saying this from the community perspectives. Sometimes being able to just walk around and do a FaceTime or a Zoom or something like that, where you're actually coming up to other employees and saying, this is our director of dining services, and he's got a mask on and stuff like that. And he's like, hey guys, here, let me show you what I'm preparing and how I'm preparing it, for the customers. So think about sort of lower cost, authentic ways to present our options. Okay, Terry Gross is from Arden Courts in Q&A says, co-marketing, we are co-marketing within our own organization. I work at Arden Courts Annandale, and I'm marketing with Arden Courts Fair Oaks. And for our webinars, since they're virtual, anybody can jump in. I love this because, trust me, I've been around for 30 years, and I have seen almost like, let's call it the corporate structure, Shady Acres Assisted Living, where marketing people within 5 miles of each other are almost like adversely marketing, okay? Meaning, oh, I've got Sue Smith, elder law attorney, speaking at my event today, so I don't want, Karen to have Sue at her event. When it really made sense, and I would always bring it up, I was like, guys, why don't you just collaborate? And one month you have an event at this place, another month you have one at that place, and you're pooling your prospect list and things of that nature. So I know I'm babbling here. Okay, guys, it looks like all the hands are done. It looks like we're at 102. For those folks that are on the line still, and it looks like we still have over 100 people on there, I'm just going to give a commercial for some of the upcoming webinars and conversations like this for you guys to know about. Again, if you go to Positive Aging Sourcebook, click on events, you can see them all. But for those of you who are in Loudoun County, tomorrow morning, Loudoun Senior Interest Group is going to have a meeting, and I'm sort of pulling the strings behind the scenes for that. Thursday, we're having a roundtable discussion on moving, downsizing, decluttering, and right sizing. That's Thursday at noon, and you're going to get to see one of these virtual tours of JK Moving Services, which was the location we were supposed to be meeting at. We're going to get a virtual tour in the way that I was describing it. Then I've also got on Wednesday afternoon, we've got Dr. DeYoung, and on Friday, this is going to be our What's Next discussion is on the Birdsong Tablet. This is a tablet that a retirement community in Virginia developed on its own with a charitable nonprofit. And we've got Professor Galena from the University of Maryland, who's going to talk about voice technology, Amazon Alexa and Google Voice and all that stuff. So, so guys, I'm going to make sure to cut and paste the chat before I cancel this meeting, everybody who registered will get the chat transcript, a video recording, and I'm also going to send you a link to join the marketing masterminds in the pro-aging community, so that we can keep some of these conversation topics going. This was great. You guys had tons of great feedback. So with that, thank you, everybody. I'm just going to kind of hang on here to make sure that I get all the chat recorded, and we will see you maybe tomorrow, maybe the next day, maybe this time next week for digital marketing. Thanks, guys.
Thank you.
Thanks, everybody.